wind up standing leg, ankle dorsiflexion, prime mover, tibialis anterior, synergist extensor digitorum longus, extensor hallucis longus, peroneus tertius, antagonist, soleus gastrocnemius, fibularis longus, fibularis brevis, posterior tibialis, flexor hallucis longus, flexor digitorum longus, plantaris. Fixators, medial and lateral stabilizers of knee, quadriceps, popliteus, musculatures of the foot.
Knee flexion, prime mover, biceps femoris, semimembranosus, semitendinosus, synergist, popliteus, gastrocnemius, gracilis, sartorius. Antagonist, quadriceps, vastus lateralis, vastus medialis, vastus intermedius, rectus femoris. Fixators, all muscles of the ankle, hip, and LPHC, especially the intrinsic stabilization system, the glute complex, and inverters of the ankle. Hip flexion, prime mover, psoas, synergist, iliacus, tensor fasciae latae, rectus femoris, anterior abductors, especially pectineus, sartorius. Antagonist, gluteus maximus, biceps femoris, long head, semitendinosus, semimembranosus, posterior head of abductor magnus. Fixators, intrinsic stabilization subsystem, rectus abdominis, obliques, quadratus, lumborum, erector spinae. Hip extension, prime mover, gluteus maximus, synergist, biceps femoris, long head, semitendinosus, semimembranosus, posterior head of abductor, magnus. Antagonist, psoas, iliacus, tensor fasciae latae, rectus femoris, anterior abductors, especially pectineus, sartorius. Fixators, intrinsic stabilization subsystem, rectus abdominis, obliques, quadratus, lumborum, erector spinae. Hip abduction, prime mover, gluteus medius, synergist, gluteus maximus, superior fibers, gluteus minimus, tensor fasciae latae, sartorius, vastus lateralis, via vasio slips. Antagonist, adductor magnus, pectineus, adductor brevis, adductor longus, gracilis, gluteus maximus, inferior fibers, quadratus femoris. Fixators, rectus abdominis, obliques, quadratus, lumborum, erector spinae, intrinsic stabilization subsystem. Spin free leg, hip rotation, hip flexion, prime mover, psoas, synergist, iliacus, tensor fasciae latae, rectus femoris, anterior adductors, especially pectineus, sartorius. Antagonist, gluteus maximus, biceps femoris, long head, semitendinosus, semimembranosus, posterior head of abductor magnus. Fixators, intrinsic stabilization subsystem, rectus abdominis, obliques, quadratus, lumborium, erector spinae. Hip extension, prime mover, gluteus maximus, synergist, biceps femoris, long head, semitendinosus, semimembranosus, posterior head of adductor magnus. Antagonist, psoas, iliacus, tensor fasciae latae, rectus femoris, anterior adductors, especially pectineus, sartorius. Fixators, intrinsic stabilization subsystem, rectus abdominis, obliques, quadratus, lumborium, erector spinae. Knee extension, prime mover, quadriceps, vastus lateralis, vastus medialis, vastus intermedius, rectus femoris. Synergist. There are no true synergists of knee extension. However, the gluteus maximus and solus could be viewed as synergists to knee extension during closed chains mechanics. Antagonist. Biceps femoris, semimembranosus, semitendinosus, popliteus, gastrocnemius, gracilis, sartorius. Fixators. All muscles of the ankle, hip, and LPHC, especially the intrinsic stabilization subsystem, the glute complex, and inverters of the ankle. Knee flexion, prime mover, biceps femoris, semimembranosus, semitendinosus. Synergist, popliteus, gastrocnemius, gracilis, sartorius. Antagonist, quadriceps, vastus lateralis, vastus medialis, vastus intermedius, rectus femoris. Fixators, all muscles of the ankle, hip, and LPHC, especially the intrinsic stabilization subsystem, the glute complex, and inverters of the ankle.